I am the mother of 5 children. I got married at the age of 13 years, and I had my first son at 15. Since I came to live in the camp, I've had access to medical assistance from pregnancy to childbirth, which has made things easier. We have access to adequate treatment, which allows us to give birth in good conditions and without any complications. After giving birth, I receive kits for myself and the baby. Pregnancy follow-up is good in the sense that it's free.
UNFPA supports key stakeholders in finding adequate responses to humanitarian emergencies by improving reproductive health and gender-based violence services for victim populations.
This house was a workplace. This was a bedroom that had been destroyed by the flood. The water washed everything away. Look, even the kids' school notebooks were destroyed. Our homes were destroyed and we were forced to relocate in camps. Life isn't the same anymore. We used to chat with the neighbors when we returned from the fields. Now that's not possible anymore.
In emergency situations, women continue to fall pregnant on a regular basis. Whether this happens before or after the crisis, these women are pregnant and need to receive assistance. Today, we can talk about the improvement of access to reproductive health services, and that is very important. Secondly, we can also mention the improvement of birth-giving conditions in health centers, to the use of contraceptions by women and the availability of condoms. UNHCR welcomes the collaboration with UNFPA, with which an agreement has been signed.
Nous avons plusieurs types d'interventions en milieu humanitaire.
We've several types of intervention in humanitarian situations, such as safe motherhood and family planning. People often forget that even in conflict situations, women still need pre- and postnatal care, as well as professional attention during childbirth. 175 resource people have been trained on how to provide sexual and reproductive health services in crisis situations, and they can easily be deployed anywhere in the country if needed. We've supported more than 3,500 pregnant women to give birth in emergency situations. Healthcare centers have access to medical supplies and medicines in order to assist women and young girls in emergency situations. We've provided financial, material and technical support to more than 5 national and international NGOs to make community-based reproductive health services available in humanitarian emergencies. More than 100,000 people have been reached by the activities we've helped develop over the past few years.
Nous avons aidé à développer au cours des dernières années.
Although significant results and achievements have been made in the field of reproductive health in humanitarian emergencies, it is essential to maintain and strengthen these efforts. By coordinating the actions of all humanitarian organizations and by building the capacity of all field partners, quality reproductive health services should be made available to refugees and victim populations.